Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls this hour right here in the studio, 866-870-5752. That's 866-870-5752. We're here Saturdays at 10 a.m., again at 1 p.m., and we are talking about orthopedic pain, chronic pain. And if you have hip pain, arthritis pain, back pain, knee pain, joint pain, then you want to give us a call. You also get Dr. Darrow's latest book for free today when you phone the program. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has actually 264 scientific studies. So the website, if you're new to the program, check out www.lastemcells.com. That's lastemcells.com. You can see Dr. Darrow performing the treatments on videos, and you can email him off of every page on the site. There we go.
Can I talk about a couple things, Nita?
Of course.
All righty. Number one, besides treating the body with stem cells and platelets to regenerate tissue and end your orthopedic pain without surgery, we also can do the same procedures on the face. It's called a vampire facelift, non-surgical, to regrow the collagen in the face and make you look younger. And also on the top of the head. It can be used for hair growth, hair replacement in a sense, to stimulate the hair to grow. And there are chapters in the back of my book about those two things. Most of the book is about the orthopedic work that I do, and we give you a free copy if you want to call into the show right now at 866-870-5752. That's 866-870-5752. I see some callers lighting up here. If you don't mind, Nita, I'd love to take a question.
Absolutely.
Are you ready for that?
Sure.
Okay. This is easy. It says, knee. I would like to set an appointment for consultation for my knee.
That's cute. That's cute.
But I got a lot to say about knees without actually the questions. Oh, actually, I did write the guy back because I answer emails all day. And to get to me through email, you just go to the website, which is www.lastemcells.com. That's lastemcells.com. Every page on the website has a spot to email me. So the person says, after I responded to them, I came to you about 2 or 3 years ago for stem cell treatment. It worked amazingly well. I want to play a lot of basketball, and now my knees bother me. Can that help? I have a torn meniscus. What else? Yeah, I'm looking forward to having you get a hold of me now so I can get into the office. Yeah, it doesn't really matter what part of the body I work on because it's all really the same treatment. All I do is inject stimulants, if you want to call them that. They're your own cells from your body that stimulate the body to regenerate itself. The body's really doing all of the work. It's a natural treatment. So, I treat meniscal tears every day of the week and rotator cuff tears, you name it. So I hope this person is listening. There's good hope to heal up your knees and get you back to playing basketball again. The knees, when we inject, what I do is I go into the area above where the joint is, where it doesn't hurt. And if there's fluid in there, I use the ultrasound that looks inside the body, not the one that heats it up. It's an imaging device that I look inside the joint, and I can see where that fluid is. I can numb up the skin and then put a needle in and get every single drop out. The knees should not be having fluid in them. And if you have swelling, you need to have it treated. Just aspirating it alone does no good unless it's blood. If it's blood, you need to get it right out so it doesn't clot. And what happens with an ACL disruption, that's the anterior cruciate ligament, those ligaments are very vascular, they bleed a lot, and if you rip an ACL, typically it's going to swell up within a half hour or so. If it's a meniscal tear that you endured, then it might swell slowly over a day or so. But it could be blood either way, and we need to get that out. When we inject above the joint and we guide the needle with the ultrasound, we're not poking the cartilage. It's basically a painless procedure, and we can put the solution right into the joint capsule. We can see that. That cannot be done blindly, meaning doctors who do that without an ultrasound. So be careful about that. Hey, we got someone waiting here.
Let's go to May in Los Angeles.
Hey, May, Dr. Marc Darrow, thank you so much for calling in. I understand that you have arthritis in your knee.
Yeah.
I didn't hear you, I'm sorry.
I'm a Kaiser member. I just want to know, do you take a Kaiser card?
Well, I'm not Kaiser. You have to go to Kaiser
I know,
for
but I
that.
wanted my insurance cover you.
No, you have to go to Kaiser if that's your provider.
Yeah, but
let's talk about your knee.
They don't do what you do. And
No, they don't.
For a while. My knee still hurts.
What have they done to help it?
I've been getting injections in my knee every 3 months, and it has not helped.
What they've been injecting is either hyaluronic acid, which is a lubricant, which I never do because there's no point, or they're giving you a steroid shot, which is the worst thing you can do because it kills the cartilage. So steroid is cortisone. That's typically the name. Do you know which one of those two you've been getting?
I think it's a steroid because they told me I had osteoporosis or something. You know, my bone is hitting bone now. Okay.
Well, osteoporosis is a systemic disease, and steroids make it worse. So if you do have osteoporosis, be careful. And for osteoporosis, if you have that, you need some hormone replacement to stimulate the regeneration of the bone. Okay, that's done by creams for a woman. You need testosterone, progesterone, and estrogen. So that's a whole different story than your knee. If your knee has osteoarthritis, then you need injections with your own cells. PRP, platelet-rich plasma, simple blood draw. We spin the blood and inject it then into the knee joint, or stem cells from your body. So I'd need to see you to see what's going on. If you want to come into the office, you can call there. It's 800-300-9300. I'll repeat it for you. It's 800-300-9300. Let me ask you this, May. Can you walk around?
I can walk around, but my knee is in pain. I've been taking meloxicam, you know, and some pain reliever, you know.
Okay.
But I've been from Kaiser. I got meloxicam.
Yeah, that's one of the worst things you can do. Okay. When you take an anti-inflammatory, what we call an NSAID, that's non-steroidal anti-inflammatory drug, meloxicam is one of those, the studies show you end up with more arthritis than if you don't take them. So I wouldn't be taking those.
Right, and it's irritating to the stomach, or else I've been taking the leave, but, you know...
Yeah, it's all the same stuff.
I'm still working.
They're all NSAIDs.
I'm in my 60s, but I'm still active, and I want to be more active, and you sound good. I want to be like you, Doc.
Well, I'm going to go take a run today, and I'm going to go play golf today, and then I'm going to lift some weights.
I know, that's right.
You ought to be doing all that, too. And if you can't...
I want to know, what's your fee? You don't take my Kaiser card. If I came in, how much I have to pay to come in?
I'll take your Kaiser card, and I'll throw it in the trash.
Yeah, I know. What's your fee for me to come in and talk to you?
If you want to talk about specifics, you got to call the office. We don't talk about insurance on the phone. And
Right,
the
just
office
call
number,
this-
you can write it down, 800-300-9300. They'll be glad. They're by the phone right now. You can call and ask them that.
All right, 1-800-300-9300.
You got it. And
All
look,
right,
Kaiser's a great place to go, but not to get healed.
I know. What you sound this song like a winner, you know, to do with the plasma and all that.
Well, I've been doing this work for over 20 years. I think I'm on year 22 right now, and it's never failed my body because I listen to myself, and I do it as many times as I have to. And that's a problem for people. You know, they think it's going to be a miracle. Like sometimes I'll inject someone, and they come back 2 weeks later, which is my typical follow-up, and they go, "It didn't work." And I go, "You didn't work it." And they go, "It should have worked." And I said, "I told you when you walked in the door and you signed something in the consent saying that it's not a guarantee and we don't know if it'll work and how long it'll take to work. You may need several treatments." And they go, "Yeah, but I expected it to work." And I said, "I'm sorry. Go somewhere else. I can't help you.
Right.
You know, if you're going to put those kind of conditions on me, I can't help you. This is not for everybody. Some
Right.
people need to have
You said
surgery.
to me,
Only
you recommend I get some hormone shots as well, right?
No, not shots. A woman doesn't need any shots.
You said pills. I'm in my 60s now.
Yeah, I don't know what you need. I don't think anybody needs anything in medicine. It's a choice.
Yeah, you're right.
So
But your
people say, "Do I need this?" I go, "It's your." I said, "My job is to educate you, and then give you the treatment if you want it. I'm not here to tell you what to do. You got to decide that. I'll educate you, and give you
Right.
the possibilities of healing. And if it's something like osteoporosis, all those drugs make it worse.
Right.
You know, the different drugs people take for osteoporosis actually cause fractures. It's crazy. It blocks the regeneration of bone. It leaves old bone. So what we do with that is we use hormones to stimulate the osteoclasts and osteoblasts to regenerate and recycle the bone to make it brand new. I've had people come in with severe osteoporosis, and within a year of starting the program, they grow their bones back. They don't have osteoporosis anymore. I've been doing this on myself. My God, I'm 72 since my 40s.
Right.
I found out in my 40s I had low testosterone. So I've been supplementing that ever since. My bones are better. I just compared my bone density reports from back then till now, and I'm growing bone.
Right.
Okay. Same thing in the body. We use cells from your body, and we inject them into the areas that are worn down, worn out, sprained, arthritic, and regenerate the body. That's all we're doing. All we do is we stimulate the body to heal itself. And platelets, called PRP, platelet-rich plasma, or stem cells help us do that. There's many ways to skin the cat, and before we had platelets and stem cells, I used to use sugar water, dextrose. It was called prolotherapy. I used sodium moruate. I used zinc sulfate. All of these irritants would help. They don't work as well as the newer technology.
Right.
And if something new comes out tomorrow, I'm going to try that. I'm not stuck in medicine. You know, it's something we have to keep moving forward with. And, you know, if
Right.
something comes along, I'm going to jump on it.
Yeah.
I want to do the best thing for my patients. I'm going to try it on myself probably first because I'm the guinea pig. You know, I've been injecting myself. I've been injecting myself for 22 years.
Right.
Anytime I get a
Seems to be working
sports
for you,
injury.
and that's what I like.
Well, it does work. It doesn't
I know.
work on everybody, and most of the time it doesn't work on people when they don't work it. Either they continue doing the activity that they should rest, or they don't get enough of it.
Right.
I don't pick patients to inject them so they'll be a loser. I pick them so they'll be a winner, but they have to cooperate and do their part too.
Yes, I realize that.
So I appreciate your call, May, and we're going to move on. We're looking for more callers. Please give us a buzz at 866-870-5752. And I'm going to repeat it for you to grab your pen and pencil. It's 866-870-5752. And if you want to just call the office directly and get more information, just give us a buzz at the office at 800-300-9300. I'll repeat it, 800-300-9300. If you want to communicate with me through the website is www.lastemcells.com, lastemcells.com. There's a spot to email me on every single page, and I look forward from hearing from you and setting up a dialogue here. I love communicating with my patients. Every one of my patients has my cell phone, and I get texts all day and all night. Everybody has my email address, and I love what I do. People say, why don't you take vacations? You need a vacation. I know this sounds silly, but doing my kind of work, if you want to even call it work, it isn't, is my passion. And there was one year, I think I took off 2 days, and I think last year, I took off maybe 4 days. So, I like to get away with my wife. We usually go to a place where I can play golf and she can hike. So we have a good time. But, most of the time I'd just rather be in the office. I love seeing you guys, and I love finding out what's going on. So let's go to Marina. I see her on the call screening page here. Her legs give out sometimes. So, Marina, what causes your legs to give out?
I have no idea. It's like it could happen anytime. I could walk, and all of a sudden I can't step on it.
All of a sudden you what?
Doctor. I can't step on it when I could walk, and all of a sudden I can't step on it. It just gives out. And I went to a doctor.
Oh, you can't step. Okay, so is it your knee that bothers you, or your ankle, or your hip? Do you know?
No, the whole leg. The whole right leg.
I get that it's the whole leg, but there's something going on that's causing that. Is it a nerve impinged from your back?
She said, I went to the doctor. She said that you have to lose weight. I'm only like 25 pounds overweight.
Yeah, but you're only 1 foot tall.
Yeah, I know. Yeah.
Marina, how tall are you?
I'm 5'7", and I'm 185.
Okay. Well,
I should be 155.
I don't judge you about that. That's just your choices and what you're eating. And it's easy to lose weight. You just stop eating carbohydrates, except for vegetables. And veggies have plenty of carbs in them, so don't worry that you'll be carb deprived. You just cut out grain, that's any form of grain, that's rice, bread, pasta, blah, blah, blah. And you stop eating fruit. Are you listening? Because you got to hear this. You got to stop eating fruit, because fructose is sugar, and it raises up your insulin. Your insulin is high, darling. When your insulin is high, you store fat, okay? And if you want to lose the fat, you lower your insulin. How do you do that? You cut out carbohydrates. It's easy. I do it. Nita does it. All my patients do it. I get all my patients skinny.
I love bread.
Right?
That's my problem.
I hear
you. You what?
She said she loves bread.
Who doesn't love bread?
I know,
that's
right?
not the point.
What's not to like?
Look, Marina, it's just choices. Do you want your legs to go out, or do you want to be skinny? You can be skinny and your legs won't go out, your doctor told you.
But I don't believe it's just the weight.
Well, you don't have to believe anything. You need to lose it anyway, because I'm going to bet you anything, and your doctor may not have told you this, but you have diabetes. You get me your hemoglobin A. What's that?
159. My hemoglobin is 159. I'm pre-diabetic.
Yeah, well, pre-diabetic is diabetic to me. If you're a 5.9, that's not pre-diabetic. That's diabetes. And what that's doing is it's putting all that fat on you, and it's killing your nerves. Okay?
Oh. You're so smart. Thank you. You're so smart. You just opened my eyes. No, it's really...
I don't know if I'm smart. I just follow what works. I'm what we call an empiricist. If something works, I do it. I make that choice. So I am about 6 feet tall, and this morning I weighed myself at 167 pounds. That didn't get that way naturally. That got that way from me not eating a lot of carbohydrates. Do I love bread? Sure.
But Brett doesn't
Do I
love
love
us.
beer? Sure, but I don't drink alcohol on purpose. Would I like to? Sure, why not?
Yeah, I don't drink alcohol. Yeah, I don't drink alcohol. No.
Yeah, but you drink another poison. It's called bread.
Yes. Yeah.
You don't have to eat bread.
And potatoes. That's another thing I love.
Well, you love it all you want, but it's killing you.
It's killing me, yeah. Yeah. You think that's what it is. It's the fat that I'm putting on makes it, because it's scary sometimes. I could walk.
I don't know the answer. Look, you're not that big, but it may be big enough for you that it's causing your legs to give out. I don't know. I'd have to examine your joints also and examine your back and see if you have some kind of a nerve that's impinged that's knocking out the nerves to your legs. I just don't know the answer. I have to examine you.
They looked at my back. There's no nerve. I did the...
You can't tell by... You did a scan, you did an MRI?
Scan. Yeah, I did
Which
the scan.
scan?
They could not find it there.
Okay. Well, then it's probably your weight and it's probably your joints mixed up together. You get arthritis from being overweight. Did you know that? That's been proven.
Huh.
So if you want arthritis in your knees, then go ahead and keep eating the way you are.
I'm going to put a mask. Here's what I'm going to do. I'm going to put a mask on in the evening. That's what I do to the breath.
They've got the masks now where you can open your mouth if you want to.
Don't get that one, though.
Yeah.
That way I will know that I should not eat bread. I'll have a mask on. That's it. I'll do something. Because I eat it in the evening. I eat the bread for dinner,
Yeah. Well, look, I don't blame you for what you like, but your choices are not working for you, that's all. You can choose to go the way you want. It's not going to hurt my feelings. I choose what I want, too. And, there's a saying that I always tell people. You can do it hard now, and it'll be easy later, or you can do it easy now, and it'll be hard later. And you're doing the easy now, hard later program. God bless you, honey. I feel bad that you're doing it the way that you don't like, but it's your choice.
Yes.
All I choose for you is love and light and health, and success and well-being. And you can have all that if you want to. Anybody can. I don't care what your condition is. It's a state of mind.
Yeah.
I spend one hour every day of my life in meditation. Why do I do it? Because it takes me to a place of neutrality and loving and peace, no matter what issues I'm going through.
Can you recommend a good meditation person for me? I'll call you all.
Yeah, me. You can come in and I'll show you how to do it. I show a lot of patients how to meditate in a way that works for them.
Thank you. And, I need it. I really need it. Yeah. Okay, I'll call.
The funny thing is, a lot of people come to me with joint pain or ligaments, tendons, neck, back, arthritis. But what they really want is to find joy in their life. And I've been lucky and found it. I've worked many, many years to find that. And I don't care what the issue is. You can always have a better attitude. And I can help people learn how to do that. And the greatest way to do that is through meditation. But you need to have a focus, and I can show you how to do that focus. So, Marina, I'm looking forward to seeing you. If you want to come into the office, the number is 800-300-9300. God bless you, Marina.
Thank you, Dr. Darrow. Thank you, Marina, for your call, and thank you, May, for your call. And thank you, Alex and Suzette, and everyone who participated. Remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.